Hello everyone, I'm Dr. Deepika Aggarwal, Senior Gynecologist and Obstetrician at CK Birla Hospital, Gurgaon. I'm going to talk about a very common women health topic today about different types of abnormal vaginal discharge and what we can do to treat it. So before I talk about abnormal discharge, let's talk about what is a normal discharge. Some women can have slight, thin, white discharge, which is usually normal. If you are having a discharge which is not causing itching or there is no foul smell, you should not worry about it. Some women may have more of it, some will have less of it. Now we come to the abnormal discharges. The most common is thick, white, curdy discharge. It can sometimes cause itching, it can cause soreness around vagina, it can cause difficulty in intercourse also. If you are experiencing that, please see your gynecologist. There is nothing to get alarmed about it. It's called as an yeast infection. We would normally give you some pastries which you can insert inside vagina for 5 to 6 nights. Sometimes, depending on the gravity of discharge, we may want to give you some tablets also, which can vary. We can give you for 3 nights or 5 days. Then comes a greenish color discharge. If it can be frothy green color, it is usually caused by a bacteria called as trichomonas. Again, it is something treatable, nothing to worry about it. Just see your gynecologist and we'll give you simple medications to treat it. Sometimes we can experience a brownish bloody discharge. Now that could be either we are having irregular periods, it may be because of spotting, or it may be a little bit more alarming. You should see your gynae. We may want to do an internal examination, what we call as speculum, where we put a little instrument inside the vagina, look at the cervix and see what is the cause of discharge. We can also get discharge through sexually transmitted diseases called as gonorrhea and chlamydia. These are the infections which are caused by intercourse, and the discharge can either be purulent, yellow color or green color. Sometimes it might go unnoticed when we don't get discharge, and the only symptom may be painful intercourse. Sometimes if the discharge or the infection is acute, we may get pelvic pain, fever, purulent discharge. You should always see your gynecologist. There are treatments for this and it needs to be treated straight away. What I do want you to know is, please don't get worried if you are getting discharge. Only if it is causing symptoms, as we discussed, you must see gynecologist. Another important thing is, once you have been treated, your symptoms might get better, but sometimes there may still be discharge in the vagina. So a follow-up is usually advisable so that we can do an internal examination and we can make sure that there is no leftover discharge. Occasionally, I see patients, they feel that it is coming back again and again. What I do tell them is that it is not because it's recurring, it's perhaps it never got cleared, and some patients will need more of treatment than just one course of antibiotics. So hope you will find this video useful, and in my next 2 videos, I'll be coming with again more important topics like how to prevent the vaginal odor and what can we do to actually prevent these discharges or abnormal discharges from happening. Thank you.